Hi there. I'd like to spend a few minutes talking to you about a really common combination of procedures that we do in our practice. And that is the lateral brow lift, short incision vertical facelift, and extended neck lift. And I'm going to talk about them basically as one procedure because realistically, when our face ages, these three areas of the face, the upper face, the middle of the face, and the neck, are all aging simultaneously. A lot of people think of them as separate areas, including some surgeons, but realistically, it's all one fascial layer that's aging at the same time. So when we're going to treat them, a hallmark, I would say, of a strong foundation of my approach to facial rejuvenation is to create a balanced and holistic approach to the rejuvenation, so that things look natural and they look like they belong together. And what I mean by that is if you're aging in your upper temple and brow area, and you're aging your mid-face and your neck, if I only take up the lower third of your face, then everything is going to have kind of a mismatch. You're going to have heaviness here and a nice lifted neck, and it's not going to look right. Now you take it one step further and you lift everything up in this direction, then you're going to have a mismatch in your forehead, and that's not going to look right. And we see that over and over again for patients who come in who've had facelifts, and then I come in and I kind of correct the overall look by applying those different pieces together. So my approach is whenever I see a patient, whether they're in their late 30s, 40s, 50s, depending on whenever this process takes place and beyond, what we want to do is basically address it all at the same time, so as you age in the future, everything is aging in a balanced and harmonious way as opposed to having this kind of piecemeal or a non-corrected sort of overall look, which can really tip people off to the fact that you've had facial work done, because it just doesn't look normal anymore, and that's a big deal. So starting with the approach, the foundation of the face is the shape of the face. So when you think about somebody who's older, say in their 50s or late 40s, and you can tell that they're no longer in their 30s, what you really are noticing is the fact that the entire shape of the face changes. It goes from being more of a heart-shaped look to, where it's heavy up top and a little bit more narrow down along the jawline and neck, to all of a sudden becoming more rectangular and long-looking with heaviness along the jawline. It actually creates a more masculine look as well. So whatever we end up doing, we want to basically take this shape and put it back to where it was. And that's why I consider these procedures not only restorative for those who've already gotten to this point, but also preventative for those who are in the early stages, in their, say sometimes in their early 40s or even as early as the late 30s in some cases, but very commonly in their late 40s and early 50s, where they're just starting to see these changes happen. So what we're going to do is basically go in there and deal with the fascia, because that is what is elongating and changing over time. It's not the skin, which a lot of people think it is. It's the deeper fascia which is underneath the skin. And just like dough gets elongated if you let it hang for a long time, pizza dough, if you kind of let it hang, it gets longer. The same thing happens with the fascia. It starts to elongate. So what I'm going to do is I'm going to go in there and I'm going to shorten that fascia and reposition everything exactly where it used to be. And as long as I do that in the correct anatomic fashion, you'll never look like you've had work done, which is ultimately what every one of our patients want. You want to look like you are yourself minus the aging changes. So in the jawline and neck, I'm going to release some of the fascial attachments that are causing the face to stay in this age position, relocate them back where they came from, carry that up into the lateral brow area, and remove the excess skin. The incisions are placed along the temporal hair in sort of a zigzag type of way, with most of the incisions being inside the hairline. So once the incisions heal, you'll have some hair in between, and then they come down and they hide in these natural creases and go behind the ear cartilage, and then down along this area, and then behind the ear. Now, once everything heals, you really can't see the incisions at all, and if you get really close, you might see a very faint white line. That's for the face and the lateral brow. Then in terms of the neck, there's a few things that are happening in the neck that are unique and special. The neck is being held up by the face. As I mentioned, this is all one fascia. So what we want to do is basically not only reposition the muscle back to where it came from, but before we can do that, we have to address what's happening under the chin. Because as you've seen with a lot of people who have aged, this area gets heavy and full. And what's happening is there's a deep fat pad that's basically underneath the muscle. It's not a space where you can liposuction, because liposuction goes directly underneath the skin. The anatomy of this area is there's skin, then there's muscle, and then there's another fat pad. So what we want to do in that case is basically part the muscle underneath the chin and get a hold of that fat pad. Sometimes it's like it's like half of a tennis ball, or the smallest, like a golf ball, of a very firm fibrous fat pad that has to be peeled off that deeper layer. Without doing that, you're not going to get that nice submental shelf that you see in young people, where everything is nice and flat under here. And then there's some other work that's done in that space to get everything to be as flat as possible. Once we get there, then we're going to tighten up the muscles through the approach that I just mentioned with the lift. Now the thing is, one of the hallmarks of my outcomes is the natural look. And people say, well, how do you get such a natural outcome with this? Well, one of the issues is I don't think of this as a facelift in the way that traditionally is done, because most of the facelifts, I'm talking like 90-something% of them, are pulling the face sideways. They're literally pulling the face. So what you end up getting is that look like you've been through a wind tunnel, or kind of a tightened, unnatural look to your face. But what I do is I lift the face back into its natural position. So when you're doing that and you're going vertical with it, which is extremely, extremely important component, when you go vertical, all of a sudden things like pieces of a puzzle look like they fit right back to where they were. And by doing that and not violating the natural shape of the face, all of a sudden you look literally like you did before the aging took place. And that's what you ultimately want. Now, a couple basic points about the procedure. One is we do these under IV sedation. We don't need to put patients under anesthesia for them, which really, really makes the procedure a lot more safe. When you think about all the bad things that happen with surgery, it's not related to working around the skin, because there's nothing major happening in this space. But what it is the risks of anesthesia. So we eliminate that by being able to do this under general. Now, it doesn't mean that if a patient wants to be put under general, we can't do that. Certainly we'll offer that if necessary, but 99% of the time, patients do it very, very comfortably under local with IV sedation. And the recovery is typically about 2 weeks. Now, all the other things that you hear about, irregularities, scarring, 99.9% of those things don't exist in this practice. They just don't, because I'm doing this operation 4, 5, sometimes 6 times a week, and doing that for the last 10, 11 years has given me literally thousands of opportunities to get the procedure down, right, and really decrease the potential for any type of negative outcomes, whether it's nerve damage or unusual scarring or any of those type of things. So, being in the hands of an expert, somebody who's dedicated their entire practice, their entire career to these particular procedures, is paramount in terms of being able to get a satisfactory outcome with very, very low risk profile. And when it comes to facelifting, it's a complicated procedure relative to other types of plastic surgery procedures. So you really, really want to ultimately be in the hands of an expert and somebody who has a track record of creating those type of looks that are conducive to a natural restoration, as opposed to looking different or looking pulled, which we see unfortunately too often, down and around town and all the social events that we see. So any other questions, we'd love to be able to help answer them. We'll be more than happy to get into more details, but I think in a general summary, that should help give you some perspective in terms of our approach.